Well, hello again, everybody. Welcome back into the Keep Boone Healthy Community Information Channel. I am David Jackson, President and CEO of the Boone Area Chamber of Commerce. And with us again, another frequent guest. That seems to be a recurring theme on the channel this week. We are visiting with President and CEO of Appalachian Regional Healthcare System, Mr. Chuck Mantooth. Always happy to have you join, Chuck. And thanks for carving out some time for us here on a busy Thursday.
You're very welcome. And I heard some lightning just above us, so I don't think there's any outdoor activities for a while. So we've got a lot of time, Dave.
Well, good. Yeah, we're good rain delay theater.
Of course.
That's right. Right. Yeah. It's like the Andy Griffith show on the old Braves games there. That's you and me right now. Well, let's talk a little bit about, what the obvious concerns are and reason why we are chatting today. We have been talking throughout the week about COVID numbers in some metrics moving up in our general area and its impact on a number of different operations. We heard from Dr. Scott Elliott about how Watauga County schools will operate a little earlier this week. We heard from Jason Marshburn on Mind Your Business today about how Appalachian State is handling their operational activities and procedures. So we look now to our local healthcare provider and ask you the question, how is Appalachian Regional Healthcare System dealing with this rise in numbers and making sure that the pieces of your support team and efforts are in place to be able to serve the community as well as I know you want to?
Yeah, I know. I appreciate that, David. I want to have a big smiley face to say everything is great, but it's strained right now. And I know there's lots of talk in the community about just rumors going around about what's happened here at the hospital and maybe have a chance to just kind of walk through some of that. I really like to maybe put things in percentages over the last 2 weeks. I think what most of the concern that we've seen across the state and the country and what you'll hear mostly about is the rate of increase. And that's what's a little bit unnerving. And actually, it's a predictor of what's to come. And over the last 2 weeks, that predictor, unfortunately, has come true. That rate of increase has just continued to go up, both in the cases in the county and then the lagging indicator there, which is the number of hospitalizations. So, it's following true to form. What we're seeing, the cases go up, hospitalizations have gone up dramatically. And but I want to make sure that everybody understands that, even though we're strained, we build a lot of our policies and procedures around reacting to events in the community like similar to this. Now, this is something we have never seen before, but we have plans that we've put in place to manage it. It's gotten a little bit harder because, on top of the surge that we came off of in the winter, we lost a lot of staff. It took its toll. I mean, the talk about mental health, not only in children, but healthcare workers, it was tough. Those healthcare workers that were with us in the winter, they did their duty. They saw us through to what we thought was the end of the pandemic or getting close to the end. And then they were tired and they chose to do some other things. We've hired 400 people this year out of 1,500 people that work here. So there's a lot of turnover. So now this latest surge combined with a shortage in staff has really just put us in a tight spot. And it's gotten worse over really the last couple of days. But I do want to make sure that we had a meeting at 11:30 this morning. We called all the staff together and we're pulling out all the stops to make sure that we have the ability to take care of patients, no matter if they're a COVID patient or have some other issue, that we're here for you.
It's amazing how quickly we've all become numbers people, right? So a lot of people look to, as you mentioned a moment ago, percentages. What can you tell us about current capacity, ICU availability? I mean, those are things that are out there in communities all around us. Do you feel comfortable with where Watauga Medical Center sits, knowing too that it's not just Watauga County that fills that hospital? You are serving as the health care hub, if you will, of 4 or 5 different counties right around our area.
Yeah, so talking to numbers, we're seeing anywhere from 20 to 25% of our entire census here at the hospital are COVID patients, and that I have access to data in our region in the high country and then also down in the Unifor, which is kind of a common area in Western North Carolina that we share, and those numbers are similar. I heard somebody say the other day there's no smoking section of a plane. So what you see in some other places is pretty much what's going to happen here, and that's been the case across the board. As far as our capacity, so that's adding another 25% on a very busy time anyway. Summer is usually our busiest month. We have a lot of folks from Florida that are in an age group that require a little bit more medical attention. travelers coming through, and then now we're having students come back. So there's just a lot of people in Boone. And with a lot of people, there are just more chances that they're going to require some type of healthcare services. So we're adding 25% on top of that. And it's kind of pushed us to the limit. But I mentioned before, we've got a resilient staff. They get together pretty much every day and try to figure out, it's a day at a time. They're trying to figure out these solutions, but they come through. So I'm trying to make sure I don't paint a morbid picture, but it is very strained right now. Not where we want to be, not where I thought we'd be in August. But regardless, we're here. We've got an obligation to take care of the community, and we're committed to doing that.
You're one of the largest employers in the community, and I think a number of folks follow your lead, follow Appalachian State's lead. Like I mentioned, we heard from Jason Marshburn earlier. As you talk to your staff and kind of put some of those marching orders in place, and I know Dr. Elliott just did this a few days ago with the school system as well, what are some of those things that you are prioritizing to maintain the continuity that you need to run your business? Because I know a number of businesses much smaller than yours are dealing with some of the same things. So what are some of those operational things that you all are looking at right now to maintain flexibility and continuity amongst all of the different practices and elements that make up the healthcare system?
Yeah, it's tough. I think there's a few things. I mean, one is we're trying to commit to taking care of our staff, and pay practices and incentives to work, or just they're short term, as you know, but it's effective in the short run. We have tried to build an environment of engagement. That's something we're leveraging as we move forward. The appeal to something larger than yourself if you choose to work in healthcare. But those are all kind of the higher level things. But internally, though, we are, as a matter of fact, this morning when we got together, we're looking at there are RNs, for example, that work in doctor's offices, work in home settings, and those type things. We've put out a call pretty much to reevaluate that distribution and say, we probably need you back at the hospital. Are you willing to do that? So it's just a matter of trying to apply the resources where it's needed the most. And right now it's needed the most at Watauga Medical Center.
Yeah, I know that's one of the things we talked about this morning on Mind Your Business was staffs having to kind of dust back off that operational manual of what it's like to stagger staffs and make sure that you've got coverage that people aren't cross-pollinating too much at a time where we're seeing a little bit more community spread. From your role as president of the hospital system, what's your message to the community right now about how they can help you all be in position to deliver quality care right now?
Yeah, so David, I'm going to go at risk here because I know this is a message that is dominating, the news and private conversations or whatever. But regardless of how people feel on one side of the vaccine or not, and information out there, and I hate we've gotten to the point to where it's a divisive issue. But really, the tools that we have right now, we talked a little about this before. I think we got online, are masks and vaccines. And those are the two tools we have. I encourage everyone to use both of those on vaccines, especially. And now I'm not saying, there are medical exemptions and there are religious exemptions and those type things. And there's a group of people that just can't take it. But if you're eligible, and that's probably the main thing people can do. I'll share a stat with you real quick, and hopefully this will hit home. But at least in North Carolina, the hospital, we are seeing some breakthrough cases. So I hear a lot of conversation. Well, I've had the vaccine, but I'm still going to get it. Let me share this number with you. The percent of breakthrough cases, which means people that have had a vaccine that end up being hospitalized or die, it's 0.5% of the hospitalizations are the breakthrough cases. That means 99.5% of the patients that are hospitalized in North Carolina are unvaccinated. It's 0.9% on the death. So you can do the math on those. I mean, by far, the best tool that we have is to get vaccinated. And that's what I would encourage our community to do. We responded early, or this community responded early as adopting that and accepting it. And that's what really kind of pushed us to a better place. But unfortunately, with this new variant, it's highly transmissible. And we are seeing the severity of those cases that require hospitalizations. It's having a larger effect on the unvaccinated.
Are you seeing any trends age-wise? I mean, I know we've heard about some younger patients and that trend kind of moving from what was thought to be an older population range with even some certain health criteria into that. Maybe I'll call it becoming more the average Joe and Jane right now too. Are you seeing that trend in your census as well?
We are, anecdotally, I had some information here that I'll find it here in a second before we leave that really keeps me in line. Well, let's see, I think the CDC reported that only 45% of the individuals aged 18 to 24 have been vaccinated. What we're typically seeing here in the hospital is it was the patients that are more over 60 and 70 years old last winter when we had the surge. Now we're seeing 30s and 40-year-olds. We still see the older ones, unvaccinated, but a larger percentage of that 30 to 40 range. And I don't have that actual data in front of me, but as far as what we're seeing here in the hospital, it's definitely a younger population. The thing that concerns me a little bit more, and I'm not sure, I missed the part with Scott Elliott, as schools start back, there is no vaccine for 12 and under. So that population is a little bit more vulnerable. We have seen patients in that age group here in the hospital. So that part is real. And, the best way to protect that age group is to get vaccinated. And so that's going to be my common theme as far as what, I would recommend to the community. I realize it's a unpopular message with some, but regardless, those are the facts.
And finally, for you on this front, then I've got one more bonus question for you here in a moment. But we know that alongside Appalachian or App Healthcare and Boone Drug, Appalachian Regional Healthcare System was one of the supreme vaccine providers back when all of this rolled out, and you all did such a great job of helping spread that out throughout your territory and throughout your practices. Is the best way for people that may be interested in a vaccine still locking in with their primary care provider? Is that how the hospital system is primarily distributing now that we're done with mass vaccine events, at least for the time being?
Yeah, it is. I think the idea early on was to get as many people as quick as we could. And when we watched it as a tipping point to where it got to a volume that we could manage in our clinics, we wanted to treat that just like the flu shot, other vaccinations that are available. And we wanted to just add that to the regimen. But that is the best way to do it. It's pretty easy to go online and schedule that with a primary care provider, at least for us. I think they have walk-ins at Boone Drug and some of the other ones. And so there's plenty of access. And if somebody doesn't know how to do it, I'll give you my cell number. Call me. You don't want me giving the shot, but I'll at least direct you to where you can get it.
Just see you pull up with just a kit,
Nobody wants to see that.
House calls from the president. So right. The bonus question for you, and ending on a little bit lighter and more positive note, anybody that's driven past your facility here in Boone has noticed a couple of cranes and a lot of work. Can you give us an update on the construction and overall hospital access right now? Because I know you've got some really exciting things going on the Watauga Medical Center campus currently.
Yeah, I like to build things, so that part's fun. I spend quite a bit of time out there watching and talking to the crane operator, and I still haven't gotten him to let me get in that thing and drive. Nobody wants to see that, but I think all grown men want to run a crane. I've heard plenty of people talk about it. But on a serious note, that part is really, really exciting. We're in an old building. We've had to move things around for COVID. It's a challenge right now. We're working through it. But the thoughts of a brand new shiny building that's going to be a great asset for this community moving forward is pretty exciting. But I know there's inconveniences, and if you've driven on this side of town, you've experienced that because we've got a lot of work with entrances and exits and the greenway that's running kind of parallel to the hospital here and parallel to Deerfield Road. Give me about 2 more weeks and that'll be done. They'll pave, have everything fixed, and you won't see the cones and the workers out there, and it'll be 2 lanes of traffic. So it will be easier to travel on this side of town. But we're really scheduling to, by the end of the year, if you're using this nice new road out here and you're looking at the hospital, by the end of the year, it's going to look like a hospital. They'll have the steel completed and the envelope completed where it'll look dried in at that point. So, and then it'll take about a year to finish it out. So, we're hoping by next fall, early winter, we'll be moving into that new facility. We have plenty of parking. We've expanded that, and we haven't had any issues in the last month. So it's been great as we've seen this surge to be able to accommodate the folks that are coming in. But we're pretty excited about what's to come.
I don't know until move-in is over on campus. I don't know if there is a convenient place to be in town. So good timing on that regard, I guess. You can just lump in with everybody else. But certainly appreciate your transparency on sharing health data with us, and awfully excited about what's to come for the healthcare system here, and know that we all understand the value of what great local providers can do for a community like ours. So we applaud your growth there, and look forward to talking to you about that. Hopefully more than COVID as we continue to go throughout the rest of the year. So thanks for your time today.
Thanks, David. Always a pleasure. And keep up the great work.